Ready? Ready? Good afternoon, everybody. I am Dina Diorio. I am the Mecklenburg County Manager. Today, I am joined by Gibby Harris, our Public Health Director, as well as Anthony Trotman, Assistant County Manager, Leslie Johnson, Assistant County Manager, Mark Foster, Assistant County Manager, and our Derek Ramos, our Assistant County Manager and Chief of Staff. And this is really our ongoing effort to provide continuing information to the community and the public about where we are with COVID-19 in Mecklenburg County. I am going to turn the podium over to Gibby Harris, our Public Health Director, to give you an update. We will not be doing any one-off interviews, but again, this is just an opportunity for you to get some additional information, and of course, we will take some questions at the end. With that, I will turn it over to Gibby.
Thank you. So, good afternoon, everyone. I wanted to update you on cases. We still only have one case in Mecklenburg County. The second one that tested in Mecklenburg County was a Cabarrus County resident. So we are continuing to do some expanded testing in the county. I don't have the exact numbers for you today, but what I can tell you is that all of the tests that we have done and received results on have been negative up to this point, except for the one. So that's the good news. We're not seeing significant spread in the community at this point. We need your help, though, in helping the community understand what they can do to help us better care for them and provide support for them as we move forward. One of the issues that we're continuing to deal with is individuals showing up at the emergency department, at the health department, at urgent cares, and at doctor's offices asking for a test. Number one, we have limited capacity still when it comes to the tests available. We are making sure that we are focusing on individuals who have risk factors that has to do with their physical health as well as any exposure that they may have had. So we have not been able to test people who are coming in who are concerned and do not have any symptoms at all. So if those folks are interested and concerned, they can have conversations with their clinicians about this who can help them better understand their situation. In addition to that, we are asking for anyone who is coming in to make sure that they call ahead. Please don't just show up asking for a test, or even if you feel like you may be infected coming in without calling ahead. That puts all of our healthcare providers at risk. We need them in their facilities being able to provide care. So we don't want to unnecessarily expose them either. So if you can help us remind the public that if you're needing care or need questions answered, number one, you can get your questions answered over the phone or have a conversation with your clinician, do some virtual work before you actually come into a facility. The other thing I want to clarify for people is the issue of quarantine and isolation. These terms are getting thrown around a lot these days. They're very confusing. Isolation and quarantine are legal terms. So quarantine is specifically utilized for individuals who have potentially been exposed to someone who is ill. And the purpose of quarantine is to limit their exposure to other people for a number of days, and we're saying 14 at this point, limit their exposure to other people who they may infect if indeed they become infected. Isolation is only used for those individuals who have tested positive. So again, those terms are being thrown around a lot. It's confusing to the public, and it's confusing to business owners and other people who are trying to inform their staff of what they need to do in case they may have symptoms or have concerns about being exposed. So again, quarantine is just for those folks that we believe have been exposed. Isolation is for those who are actually positive. I want to reinforce the fact that we, regardless of what you hear, we still have limited access to testing in this community. We're doing everything we can to get the supplies in and to have staff ready to be able to provide more testing, but we are targeting the testing that we're doing to those individuals that we think are most at risk. We continue to encourage the community to be very vigilant about taking care of themselves. And you've heard what we've said before, washing your hands, not touching your face. Some social distancing. We're not talking about social isolation here, folks. Again, don't use that isolation term And that way, we're talking about social distancing, which just means don't necessarily spend a lot of time in large gatherings if you don't have to. You put yourself at risk when you do that. And if you're over the ages of 65 or have a chronic disease or have a compromised immune system, please, we really want those individuals to limit their involvement with large groups. So we want to continue to reinforce those messages to our community, and we're going to continue to meet with you on a regular basis so we can get the messages out. Thank you for that, and I'll be happy to answer any questions.
So I'm wondering, because we've been hearing from the state level that they have enough tests to test like 700 people. I'm wondering what that trickle down looks like. So those are the 700 people, like those tests are coming from the CDC. How much does Mecklenburg have from that?
We were sent 3 tests. And what we were told is after you use those, we'll send you 3 more. So we have, again, limited access to that. We do have access to some of the media that you use to plate the specimens, and so we're using those judiciously as well. But the message from the state yesterday is if we wanted quick turnaround on testing, that we should send our test to LabCorp.
Jimmy, clarification, are you only getting 3 tests at a time from the state right now?
Yes.
How is that acceptable?
That's a good question. It is what they have available to give to us. They have 100 counties, and they're sending tests out across all of the counties at this point.
Why is that? I mean, whose fault is this? How is it that we're in the United States right now and we don't have enough supplies to test people in the midst of this pandemic?
That's not something that I can answer. We've seen mixed messages around testing, and we also know that the supply is just limited. So we're doing the best we can. We're working with Atrium, who has some capacity to test, and we're continuing to work with LabCorp, who has some capacity to test. But everybody's a bit limited at this point. Unfortunately, in this country, we're behind with our ability to test.
Have you been given any indication that number will get larger?
We have been told that it will. We have ordered more medium, but it's on back order. That's the other challenge that we have right now, is a lot of the supplies that we need that specifically help us address this issue, whether it's protective equipment or whether it's media for the testing, is in limited supply as well. So we're doing what we can to expand that, but that's the best we can do at the moment.
Go ahead.
How many people has the county tested, just 3 for coronavirus?
We don't have the exact number now. We're working on that, and as soon as we know, we'll let you know.
How would a trickle-down effect does only having 3 tests in the county have? I mean, it's fair to say that there's more people walking around who have coronavirus who haven't been tested because of the lack of testing, correct?
Well, the issue we have in this country right now is we have not been able to do sufficient testing to do active surveillance, which is typically what we do with a communicable disease. And that gives us an idea of what's going on in the community. So we really do not have the information we need to be able to clearly say what the total extent of the issue is in Mecklenburg County right now.
Are you working with Charlotte-Mecklenburg schools with just a contingency plan of maybe shutting down schools behind the scene? I mean, is this something parents should be prepared for?
We are meeting this afternoon, both with business leaders as well as school systems and others, to have conversations about some of these things. We have been looking at the guidance that's coming from CDC. Right now, there is no guidance, specifically no guidance. I mean, they have said they have no guidance and no recommendation on closing schools at the state level. Obviously, everything can change in a minute, but right now, we are not making any recommendations to the school system. They're having ongoing conversations about this, and we are participating in those conversations with them.
So just to follow up, if there are 3, if you got 3 tests that came from the CDC that then went to the state, but you don't know how many people in Mecklenburg County have been tested, what are other options for people to, like, where are other avenues that people could have been tested?
So any clinician at this point in time, if they are willing, has the ability to test. They can send the test to LabCorp.
Or to Quest?
Or to,
right?
well, Quest, what we understand from Quest is that they have targeted their resources to the West Coast right now.
So right now, just LabCorp?
LabCorp.
How fast is the turnaround from the state when you're asking for 3 more tests? How
It usually only takes a day or two. It's not a significant amount of time.
A lot of businesses over the weekend are closing their doors because of fear of crowds and whatnot. Is that something that you would encourage other businesses to do, like breweries and whatnot, in the popular growth area?
Well, the governor has suggested any gatherings of more than 100 people. We should consider, and we don't have specific recommendations at the county level at this point. We're going with the governor's recommendations right now, but as I mentioned earlier, we're having conversations later this afternoon around that as well.
Gibby, how many tests would you ideally like?
Well, ideally, in a community this size, we would like, I don't have a particular number for you, but we'd like to test enough to be able to understand what the situation is in the community.
Is it safe to say significantly more than 3 tests?
Significantly more.
Ms. Harris, is it really, I mean, there's no chance that you're going to get thousands of tests in the next 2 weeks. What is your message today? I don't think testing is going to work. Is that fair to say? So what do you need the Mecklenburg people, Mecklenburg County residents to know now?
Several things. Number one, I want to excuse me, reiterate that 80% of the individuals are likely to have mild symptoms. If you have mild symptoms of a fever, a cough, stay home. Stay home. There are many people who have the flu that don't go to the doctor. And we know that we're still in the middle of flu season. So if you have mild symptoms, if you just stay home, don't go back to work, don't send your kids to school. The second, I would say, is if you have specific symptoms and they're fairly severe, then obviously you need to be seen. And that's it, depending on how the severity of that, whether you go to the emergency room or whether you're seen in an urgent care or your doctor's office. But again, I want to emphasize the fact that people need to call ahead if they have those symptoms.
I think there's a lot of fear right now
Yes.
in the community. Obviously, understandably, you go to the grocery store and see items run off the shelves. I mean, just in your professional experience, how likely, as this escalates in the county, are we to see a potential mandatory quarantine or something like that for all residents? Are we on that track?
It's difficult to say at this point. If we look at the trajectory of this infection in other communities, the expectation that we are going to see escalation is real. The extent of it we don't know, and some of the things that we're putting in place and some of the things that businesses and county and city are considering limiting and those sorts of things will help us from a social distancing standpoint. So we are hoping that that will have a positive effect on this and will flatten that curve that you've seen the video that's out there now about how those sorts of efforts do flatten the curve out some, and so that maybe we won't see the extent that they've seen in other places. That's all we can do at this point, is continue to try to contain as well as address the issue, mitigate the issue for those who may be infected.
Okay, one more question.
Can you walk us through why the governor's not recommending closures of schools at this point?
At this point, what we've seen from the CDC is that if closing schools for 2 to 3 weeks really does not have much impact on slowing the spread. If you're going to close schools, you would need to do it for a much longer period of time for it to really have a significant impact.
Just one quick time frame thing. So when did the state send the 3 tests? And then do you expect any more now that we're seeing, or now that they're saying they can test 700 people at the state lab?
We have not heard that we're going to get another significant bolus. We can ask for those to be replaced. When we send the test kits to the state, they will send us replacements.
Thank you, everybody. We'll be back in touch.
Thanks.